All right, hi everyone. My name is Samara Robertson, and I am so excited that you're here to chat with me a little bit about Postpartum University. Um, People might be sort of coming in, and that's totally fine as we get going. We've got about a minute, and then I'm going to start my presentation. And just so everybody knows, I am recording this for future use. So if you have specific questions, please, you can email me, but just know that this is a recording that I will be using in the future. We got some people clicking in, so we'll give a minute here as I get in. It's so nice to see everybody on this new year. So let's get going. It's 12 o'clock and let's start. So I'm Samara Robertson, and welcome and thank you and happy new year to everyone who's come. I know it's a crazy busy time, so taking the time to come listen to this, I really appreciate it, and I think you'll get a lot out of it. My goal is really to get this sort of done. I can speak pretty fast, so I'm hoping in about 30 minutes we'll get through. I can't really see the chat right now, but I will at the end. Look at the chat if you have questions. I have everyone on mute and off video just to make it smooth. So if you're making breakfast or lunch or whatever, it's totally fine. So a couple housekeeping things. This is being recorded because I need to use it in the future. You know, it's nice to have when I've already sat here. There will be spelling errors in this presentation. I guarantee I'm not perfect here. This is meant to be informative. It does not encompass all issues in the postpartum period. I did my best to do really high level stuff, but my gosh, I could do presentations like this on any topic over and over. I love talking about this stuff. I am a work in progress. I do not have all the answers, but I am always willing to try to find an answer. I love research. I love figuring it all out. And I come to this world with a perspective of a cisgender, white, heterosexual female. That's how I live my life, in this perspective. And I so believe we need to listen to more perspectives, and we need more diverse perspectives in the healthcare field. And that is just where I come from in the world. So let's talk about really quickly my objectives in this presentation. I want to introduce you to myself and my experience, discuss current postpartum care, the horrible outcomes that we have, unfortunately, and the barriers that we have to what is abysmal postpartum care in the United States, and introduce the idea of postpartum university, what it looks like, why I think this could really revolutionize postpartum care, and hope that you spread it to your friends, your family, your patients, and that maybe you're interested in coming and joining in this really exciting endeavor. And so a little bit about my background so you know where I come from. I'm a certified nurse midwife. I have been since 2010. I'm an advanced practice registered nurse. I'm licensed in the state of New Hampshire, Maine, New York, and Arizona. I've been an assistant faculty in online nursing education for over 10 years, program director for a women's health nurse practitioner program. I'm a doctorate of nursing practice student, which is insane. I'm a former IBCLC. I have a personal history of postpartum depression. I'm a mother of two, and I'm literally trying to survive in a global pandemic, just like all of you. We are all trying to survive, put one foot in front of the other in what has been an insane year. And while I am so hopeful for 2021, there are a lot of challenges ahead of us, and we still need to be working really hard to improve and close gaps in women's healthcare. I'm a women's health advocate, postpartum expert, and mental health specialist. So many letters on my name, but I'm just a mom. Like, I am just a woman in this planet trying to survive. And I have had two children, and I couldn't have been more prepared. I was looking back at pictures of myself when I had my daughters, um, Adeline, she is turning 9 this year, and Eloise is 6. And I was so prepared. I was a certified nurse midwife. I had seen thousands of deliveries, right? I was studying to be an IBCLC. I had every tool I could possibly think I needed, literally at my bedside. I was completely unprepared for the experience I was about to unfold in those first 12 months of my daughter Adeline's life. I was cared for by 3 midwives. No one did a mental health check on me. No screening tools, no asking me my adjustment in the postpartum period, absolutely nothing. I mean, it's mind-boggling to me to be a certified midwife and think back to that and to feel so disconnected. I remember sitting at this table, literally Googling, does being a mother suck? Just because I felt so isolated and alone in that experience because I was so unprepared. And then so you fast forward here, this is Eloise. I don't know, she couldn't be more than a month or so here. And I had a really rambunctious toddler. And it was still really hard. You know, if I was really honest with myself, I know that it really took me probably until Eloise was at least 2 to really get through what was me sitting in postpartum depression. And I'll never forget being dismissed by my provider when I was postpartum with Eloise at my one little 6-week postpartum visit. My provider asked me if I thought I really did have postpartum depression that first time around, or was it just having a first child? That was such a sort of traumatic experience in being dismissed in what I knew was such a hard time. And so that's my personal experience and really why I'm motivated and I want to do something about improving postpartum care. And then the last 2 photos of myself is this is me with my 2 girls, and that those really rough stages, and this is me now just over the summer. And I can't tell you the difference of who I am. The smile looks the same, my eyes look the same, but I was so depressed here, you know, and no one knew. You wouldn't know looking at me. And so that's why I do what I do. I want my daughters and their partners to live in a world where that is unfathomable to them, that that was our postpartum experience. It's time to do healthcare differently. It is not working, and we're going to discuss that. And I'm really going to show you what's happening out there. And you're going to come away realizing that we have a broken healthcare system that really was never meant to support women and families in that postpartum period. We need to find a way where we provide families and we support them with information, with community and care throughout that entire postpartum period. That's where we need to be going. And I truly believe that all women's choices need to be celebrated and supported, because when we shun or shame women's ideas, we erode her confidence in herself and her ability to be a mother and her family. This is where I stand, where that women and families should be empowered to advocate for their own needs, not the needs I think you need, but your needs in a family-centered approach. And when we give families back power and healthcare, the health outcomes will improve for the entire family. Maternal health and maternal mental health are core tenets of the health of our society. And we know that partners are not immune to the challenges of mental health in the postpartum period. We need to bring our partners into this process. Our communities are key players in the health and mental health of women and families. We cannot do it alone. We need our communities to come together. And when we focus our energy on the health and wellness of that first year postpartum, we all benefit, all of society. And that's where I keep going back. And that's why we're doing what we're doing here at the Postpartum Midwife. We need to invest in our families. So now that you kind of see where my brain is and really where I stand, let's talk about prenatal care a little bit and postpartum care, because I really want you to wrap your head around this. And once you do, this all sounds like the most simple solution. So women receive 13 prenatal visits in their pregnancy. These are specifically timed visits for physiological needs, for baby monitoring and mother monitoring. These are set by our healthcare system. Our insurance companies have decided that this is preventative care in pregnancy. Okay, right? Most of you are either going through that or you've been through that. And these visits, unfortunately, can be only, some offices are 15-minute slots, maybe 30-minute slots, but certainly not even enough for the prenatal period. And then I want you to think about the cost, because this is really important as we go through this whole presentation, is to think about how much we spend on care and what are the outcomes we have for our women and children. The average cost in the US without complications in 2010, and this is going to vary now, obviously this year and from region to region, but I just want you to get an idea. Prenatal care alone, the visits you go to your physician, are about $2,100. A vaginal delivery when you go into the hospital is between $12,000 and $16,000, and a C-section can range anywhere from $20,000 to $24,000, completely depending on where you live. Yes, insurance covers some of that, but think about what our insurance companies have said is the value of our prenatal care, $2,100. Newborns receive 8 newborn visits spread out for the first 18 months of their life. Again, these are for physiological needs, either growth, development, immunizations, and they're set by health insurance, and these are with no complications. We spend in America about $6,000 for our well baby checks, right? And those are for baby, not for mom, those are for baby. And then we come down to our postpartum care in that whole package, where women receive 1 6-week postpartum visit. And that cost is about $150 is what our insurance company has decided we are worth in that postpartum period. 6 weeks is 6 weeks too late. You are already isolated, alone, you have no one to reach out to. That is too late, and we cannot package a postpartum period into one visit. It's mind-boggling. If you've had a baby before, you know exactly what I'm saying. And if you haven't, you will understand how insane it is that we have one 20-minute visit. And this, again, is based on physiological needs where a physician knows or wants to see if your uterus has completely involuted, which means it's back to the pre-pregnancy state, you are not bleeding anymore, and then your green light for sex, right? Like, which is, again, crazy. Yet we still have the worst outcomes of any developed nation in the postpartum period. I'm going to get to that more, but I want you to just wrap your head around that for a second. The value of your postpartum care is a $150 20-minute visit. It's not the OB's fault. It's not the midwife's fault. This is a system we live in. Okay, so that's what we have to think about. We're living in a system, a healthcare system that is already made. There are so many barriers already for women in that 1 6-week postpartum visit. Women are already feeling judged for their decisions and not being honest with their providers. We now have a global pandemic and the coronavirus and those fears that come with that. Transportation. Many of you are either on your first, your second, or third baby, and now you have children at home who may not be in school. How is that transportation going to work? You're already feeling worried and isolated. Many women are actually seeing a decrease in providers in their states, especially in rural areas, so our access to care has gone down significantly. We have time constraints, and we're feeling like we're in a system that doesn't even see us, that we're not even included in once we finally get to that 6-week postpartum visit. And many women are opting out of it completely out of fears of coronavirus. That's a problem. The postpartum period is a minimum year experience for a mother, a woman, a partner to go through in what is never going to be a linear process. It is a process full of ups and downs where your physical body is changing, your mental and your hormonal shifts are happening, you're sleep deprived, and you're in this new identity that you're trying to figure out. That doesn't happen at 6 weeks. That happens over a course of a year. And if you then have a child right after a baby, you're going through that process again, right? So this is a continuum. This is something that we're going through month after month after week after week. And so I've sort of split up the postpartum period into these 4 stages, and these are very arbitrary, but when I thought about it, I really thought, what's happening in the postpartum period? And ideally, postpartum care starts prenatally, but again, like I said, we don't have a healthcare system that supports that. And then we go through a very immediate postpartum period in that 0 to 3 months or 12 weeks where there's so many physical changes for mom and baby. Then we're going to be in an adjustment period from 3 to 6 months, and then a transition period from 6 to 12 months. These are not stopgaps. These, again, are 2 steps forward, 3 steps back, and women need to be supported differently at every one of these steps. So this is where I go over a little bit about the data, because I want you to kind of digest what I just said, think about the barriers, right? Think about what we're doing, the system that we have, and let's talk about the outcomes that the United States has for our women and families, because it's unbelievable. I've been a nurse since 2005, and I can tell you that all this data I see over and over and over again. So maternal mortality is defined as the death of a woman during pregnancy or within 1 year of the end of pregnancy. The United States maternal mortality rate is the worst of any developed nation with similar birth rates. Like, that is mind-blowing. We spend the most per patient, the most per woman, yet we have the worst outcomes. Look at these numbers. Again, you can find this over and over and over again. And what I find so fascinating is all of these countries here have some form of universal health care, paid maternal and paternal leave, or postpartum care. We are missing something here. It is not working. This slide, I think, is really important to think about too, because when I was thinking about Postpartum University and thinking about that full postpartum year, this is maternal deaths over the entire postpartum period, right? 52% of those maternal mortality deaths occur between day 1 and the full year postpartum. We need to fill this gap. Right? This is a healthcare emergency. And it's not just maternal mortality, it's near misses. It's women needing care this entire time. And I think it's so important that we address the racial disparities in maternal mortality because they are so significant. And again, it tells us that what we are doing in the United States healthcare is not working for everyone. It's not working for anyone. Again, mind blowing. We need to change this. And again, these aren't new numbers, everyone. This is, again, I've been seeing this over and over and over again. We need to do something different. And we are in a post-COVID world now where whatever was working before, which it wasn't, we need to readdress. So I pulled these, I just want to kind of pull these from that research article because this is what I took away from it. 60% of pregnancy-related deaths are preventable. Preventative care, right? There are significant racial and ethnic disparities that we need to address. And there are 4 contributing factors they identified related to death in the postpartum period: community, health facility, patient and family relationship, provider, and healthcare system. And then they went on to say, innovative delivery care models might be further evaluated for their potential to reduce maternal disparities. There's no might anymore. We need to find innovative care models to improve the outcomes for women and families. It's obvious. I don't think any of you would look at those numbers and say, wow, whatever we're doing is working. And so I want to shift a little bit because we've talked about the physical changes, which there are so many physical changes you experience in the postpartum period, to the mental, because physical and mental health are completely tied together. And the postpartum period is a mental adjustment. And so how does a global pandemic impact the postpartum period? It impacts it immensely. Women are told now when they were pregnant in their postpartum period to stay home, to do this alone. And we are already facing what is such an isolating time. How then do we continue to improve outcomes in a global pandemic, right? Postpartum depression is the #1 postpartum complication pre-COVID-19. People don't know that. So let's talk again a little bit about the numbers. And I want you to remember, these are people, right? These are women, these are families. These aren't just numbers. And so when we just say those numbers over and over again, what I get so frustrated about is, what are our solutions? If 20% of women experience a perinatal mood or anxiety disorder pre-COVID, that's awful. 50% of women with a perinatal mood or anxiety disorder have no risk factors. This is pre-COVID-19. 50% of women do not seek treatment. And we talked about some of those barriers earlier, right? These are all pre-COVID-19 numbers. We know in research that these numbers are always underrepresented, and we know that these are higher in real clinical life. A study out of Brigham and Women's of 1,000 women in post-COVID world surveyed, 1 in 3 had significant levels of depression, 36% of women. We are on a rise of mental health challenges in the postpartum period, and we need to support women where they are the entire postpartum year. And one other thing that you probably hear all the time, 80% of women will experience postpartum blues. Right? We said that pre-COVID, 80% of women. What if we stopped saying that and we just said postpartum period is a period of adjustment of mental and physical change, right? Let's normalize the experience of women in the postpartum period and support them where they are. This is my last slide because, again, this is why I want you to see is where my brain is going and why I said we have to do something. This study came out in 2020, all this data, and it is trends in suicidality 1 year before and after birth among commercially insured childbearing women in the United States, 2006 to 2017. Look at this rise. Look at this. This should make every clinician say, we have got to do something better, because this doesn't even account for what we're experiencing right now, which is a global pandemic. We are in a healthcare emergency, and that is why I am doing what I'm doing. Postpartum care is a public health emergency. We need healthcare systems, community workers, employers, insurance companies, our schools, our governments, our community workers to come together to find innovative solutions to help families, right? It is obvious. It is obvious we need to be doing something different. And while we need the community to come together, we know that women need individualized care. No 2 women need the same thing in the postpartum period. Many need similar things, but not in the same way. And we need to be providing care at a family-centered approach, because what your family needs and this family needs is completely different. And I really believe if women have timely, accessible, inclusive care that empowers them to make the right decisions, we can improve outcomes. Right? There are so many tools we have, but if we don't give them to women and families to find their right care, then we're not being the healthcare providers that we should be in this period. So let's close the gap. And this is where Postpartum University comes in my mind. We have healthcare providers who are caring for women in prenatal and postpartum care. We have healthcare workers who are trying to fill the gap, our lactation consultants, our therapists, our nutritionists, our physical therapists. They're doing the best they can to fill the gap. We have our community resources, our mommy groups, our baby groups, our daycares, right, trying to fill the gap and help women. We have incredible screening tools, but how are we using those screening tools to help women? And where is the preventative care? Where is the care to help women be ready for the ups and downs of the postpartum period, to give them information that is relevant, that is timely, and allow them to monitor for when they're at risk for a postpartum complication, so they can spend more time enjoying parenthood and thriving? Information is power and allows families to thrive. And that is where this idea comes from, is if a family, patients, had a community that was going through the same things, the same experiences, to lean on one another, to create a sense of peer support. If they had courses that were evidence-based, that were non-judgmental, that were informative, so you could make informed, shared decisions with a healthcare provider guiding you along the way. That is my vision of providing timely, evidence-based, accessible care to women and families. And that's where the idea of Postpartum University came. If we took that and we created a place for families to come and thrive. So let's take a look, hopefully this still shares, at what I see. I'm hoping you can still see this. Someone just give me like, Tara, will you just text me if you can see this? So this is Postpartum University. So I actually had a entire different system I had thought about using for Postpartum University, and then I came across this. And I've been teaching in online nursing, thank you, for 10 years. And what I have found so frustrating is the limitations of online platforms. And this platform was like the clouds opened, because I could do everything that I had dreamed of doing in this one platform. This is where I want us to come together. Okay, perfect. And create our own community. So we're creating a community with courses where we can speak to one another. It's almost like our own Facebook, but on steroids, and that can be monitored by a healthcare professional. It's so exciting. And I can create events here. So one of the things in Postpartum University is recurring events where we come together and do care together as a community and support one another. So everything is accessible on your phone, which I think is so important for families and women who are up at 3 in the morning and trying to figure things out. And every course that is created is accessible to you in Postpartum University. So Postpartum Bootcamp is here and available, and within it, you can create a whole nother community. It's really mind-blowing the things you can do with this platform. We've got Birthing Bootcamp, Postpartum Mood Changes, which I'm still developing. Again, we're coming to do this together. So this is an exciting endeavor that I get to build with you, because patients should be driving healthcare. Your needs are what I should be creating. We're going to have a Postpartum University video vault. So what I love about being an educator is if one person has a question, then 50 people have the same exact question, and I can create a resource for you so you have it, and it's all searchable here. So at 3 a.m., if you want to search mastitis, you're going to have it here. And you're going to spend less time on what I find to be very overwhelming resources like Google, and a lot of those Facebook groups have thousands and thousands of people. This is us coming together for a very specific need. And I'm just super excited, because I think that this could be really revolutionary in how we support families. I can also post polls on here. So if there's a topic you want to have and talk about on that live session, you drive it. So this is the platform. So now I'm just going to go back to my presentation. Okay. Okay, so let's talk about frequently asked questions. And so, because you're probably thinking, well, how does this all work? So new and experienced moms are welcome. Everyone is welcome because we can all learn from one another. The amazing thing about that platform is anyone can join during the postpartum year at any time. Because the way that it's done, we can set up into stages, and you can actually be in a stage, show everyone what stage you're in, and we can support you in that stage. So it's really exciting. We don't shun anyone away for your decisions. We support decisions. If you breastfeed, if you bottle feed, we are here to support you, right? There is no wrong way to do this. It's about having the right information to support you. People will ask me, is this covered by insurance? Well, it is not covered by insurance. My plan is to create an actual letter for either your human resources or your insurance company to talk about the benefits of this model of care to help you get some reimbursement for this coverage, which I think we could do. This is not emergency care. This is preventative care, right? This is where I am an educator and I'm a coach. Can you see me one-on-one as a patient? Yes, and I'll talk about that in a minute. This does not replace your need for your OB or your pediatrician. I can prescribe in these states, but just because I can only prescribe here doesn't mean I can't see you one-on-one. We can create treatment plans that you can then bring to your provider where you have the evidence, you have the knowledge, you have the power to know exactly what it is you need. That's me empowering you. You can do a monthly fee, which is a cancel anytime, or I'm going to do a 6 or a 12-month membership. And you can do, there's a 14-day money back guarantee on those. So you can come and see, is this the right thing for me? Because I want this to be the right place for you, right? Everyone needs something different. And my hope is that it is the right place for you to thrive. So what is included? So let's talk a little bit about what's included in this membership platform. So if you join Postpartum University, you will get 50% off any one-on-one patient visit that you need to make with me. I am an independent provider. I have an entire patient platform that is HIPAA compliant, that has super bills that you can send for reimbursement, so I can work with you in that way. Or you may not need me, right? You may get enough out of these preventative healthcare measures to know what you need from your provider that you have. Anyone who is on the 12-month membership will get a free initial visit, part of their membership. You can use it anytime. You'll have access to all the postpartum midwife courses that are live, and any one that I make, you will have access to for that entire postpartum year or however long you are at Postpartum University. You'll have the Postpartum University Video Vault, which will grow. That is going to grow with us, and I'm really excited about it because I do lots of videos to teach. We'll have a closed community. It is like Facebook on steroids, except we control it. We are the ones who own it, and you have a group of women and families going through the exact same thing to support you. We'll have specific resources, and an example of those will be, COVID-19 restrictions, COVID-19 vaccinations, LGBTQ patient resources. I mean, you name it and I'll make it is really the deal. That's why I'm here. And I'm really excited about guest lecturers because I have so many contacts that are all over the country. And I want this to be a place where you come and that's all you need. If you want me to find a lecturer on lactation, I will find them and I will bring them and I'll contribute to. But what I'm saying is you own this and I lead the way. We'll have weekly live sessions, again, depending on who's in Postpartum University, the different topics. We'll talk about all the healthcare needs every week, and that we will also have weekly emails. And so what's really hard, I think, about the postpartum period is this is a lot of information. I certainly don't expect you to come in and start taking a class. What you need is guidance. So every week you're going to get an email to help guide you to know what it is you should be focusing on based on where you are in your postpartum journey. That is key, right? I am a guide. I am your guide. So let's talk about the cost, because I really thought about this a lot to think about how do we make this affordable, but also I'm the only one here, so I want to make sure that I can be 100% here for you. So let's remember the costs that we talked about. An epidural anesthesia is $2,000, right? We talked about the cost of vaginal delivery and a C-section. The first year of a baby's life is the average family spends $12,000. The average family spends $1,000 on coffee per year, right? Like, think of all the things you spend not on yourself. Women are so classic where we do not spend on what we need. Like, what if you took a year to invest in yourself and allowed yourself to do that? I am the worst at this. I am so stubborn in investing in myself, but as soon as I do, I realize that I'm able to care for those in my family and around me in a much more effective way. So think about that. What is this 1 year worth for you and your family, so that you have information, you have a community, and you have someone in your corner for an entire year? That's my goal. So let's come together. Let's start something that represents the needs of families, where they feel supported, empowered, and cared for. That's what families need. The status quo isn't working. We saw that in every number I just showed you. It is not working, but we have the power to be the change. We can do it. If we allow patients to be the ones to create the healthcare system they need, imagine the outcomes that we could have. You are the guy, you are on this journey, right? We are healthcare providers just to see you along the way. And I truly believe that if we give the power back to people, we will see the most change. At Postpartum University, it's really important for me, if I start something, is that I have a mission and that I stand on that mission in everything I do, that grounds me and reminds me why it is I'm doing this. I'm committed to providing a place for women and families to find evidence-based, supportive, inclusive information to improve the outcomes of families and children in the postpartum period and beyond. Because when we invest in the postpartum period, we invest in our society. I truly, truly believe that. I'm committed to expanding the racial and ethnic diversity of the healthcare workforce through mentorship and preceptorship. I want to expand education on racial injustice and LGBTQ patient rights. We need to diversify the healthcare workforce to see our numbers improve, and I'm incredibly passionate about that. I really thank you all for taking the time. I think I was pretty good on my 30-minute promise. I am so passionate about this, and I hope that from this you see that in me, is that I really want to change how we're doing things. And I really think that this could be a way to revolutionize how we provide preventative care in the United States. If you have specific questions, please email me. I'm happy to do a Zoom chat with you. I love talking to patients. Like, this is what I do, and this is what I want to do. You can find my website if you haven't. You can read a little bit more about me. You can follow me on Facebook and Instagram. I'm trying to figure that all out. And my goal is that we start Postpartum University this month. January 21st is when I'm going to close enrollment. So if you're interested, let me know. Full disclosure is that after this chat, you're going to get some emails that are going to invite you to enroll. I've been playing around with all the technology. And if you have any question, do not hesitate. Seriously, do not hesitate. And if you're a provider or a community member or someone who is also on this path, I want to talk to you. How can we work together to close this gap? So if anybody wants, oh, I see a couple chats. Here we go. If anyone has just to be clear, are we only able to receive services until our child turns 1? That's a great question. We are just starting. So we are just starting, and I don't know how this will unfold. And I actually had someone who contacted me prenatally. And I mean, I would love to even do something like this prenatally, because it would be so amazing if we could go from pregnancy into postpartum together. I think that we have something really innovative here, and I'm open to wherever this takes us. Any other questions that anyone has, you can put in the chat. You can come off mute too. I think I muted everyone just in case you were like at home, but nope, that was all the questions. But yeah, I love it. I love it. And I am just like you, right? I'm just trying to figure out how the heck do I raise 2 children during a global pandemic. And it was really the lockdown that reminded me of that feeling of the postpartum period, was remembering how traumatic that all was, and imagining all the pregnant women and the postpartum women trying to endure what I went through in a global pandemic. And that was really the catalyst. So that's all I got. It was so fun. I really appreciate everyone taking the time to come. I'm going to stop my recording. I'm going to stop sharing.